I have updates, and they're not good. In the disturbing case I told you about a couple of days ago about the 2 nurses that were nearly raped at Mount Nittany Medical Center in Pennsylvania. Go back and watch my previous video if you don't know. It's very disturbing. Okay, so that patient had apparently just been released from prison March 26th. This incident took place April 11th. And I don't think much time elapsed in between because he was apparently being held in the ED in the psych holding area for several days prior to this. He required numerous chemical, physical restraints, allegedly, and no inpatient facilities were willing to take him. So he was being held there, which we know happens all the time. The nurse had been left alone in that unit, in that area. Again, recipe for disaster, right? Again, not enough support staff, allegedly, I'm assuming here. Multiple things then went wrong. So, the panic buttons that you wear on your badge, right? The ones with the 3 buttons and the colors, that allegedly malfunctioned, did not work at all. But no worries, there's a backup. They have a code gray alarm that you can push on the wall in the patient's rooms. That one worked, but it really didn't matter because they didn't bother to call it overhead for 4 or 5 minutes, which is an eternity, right? If you are being assaulted, if you are having your clothes ripped off. The reason allegedly for not calling it overhead, well, we didn't know if the alarm was real or not because, they get pushed by accident or by patients all the time. So we didn't know. I am sure that your policy does not say wait and see. I am sure that your policy says announce it overhead immediately. Whoever failed to call that overhead needs to be held accountable. That person very nearly has blood on their hands. This is so egregiously unacceptable. How dare you not call that overhead? How dare you? Err on the side of caution. But wait, it gets worse. Security, who was supposed to be watching the cameras for that area, weren't. Because again, not enough staffing, right? In every conceivable way, they just keep cutting people and staffing, and then people aren't where they need to be when these things occur, right? Because they're getting pulled in other directions, and security doesn't have enough staff, allegedly. Now, these nurses, from what I understand, are extremely traumatized. Of course they are. I cannot even imagine. This is absolutely terrifying. I know that person has a preliminary hearing today. I will keep you guys updated on this, but this is very, very upsetting. The system failed them again and again and again. They had also apparently been negotiating and pushing for increased security measures for quite some time before this. And no surprise, the hospital allegedly was only willing to give them a safety committee that meets quarterly. That's it. I've told you guys a million times. Those committees are nothing more than a red herring to make you feel like you're doing something. They're not enforceable in any way, shape, or form. They are useless. Useless.